So you're wondering about Plavix loading doses after a stroke,
Yeah.
and if it's the right call.
Okay.
That's a question a lot of people are asking. It's
Absolutely.
a great question.
Yeah.
And we're going to dive into that today.
All right.
We're going to take a deep dive into the research on
Yeah.
Plavix loading doses for acute ischemic stroke patients.
Sounds good.
Just for you.
Awesome.
So to really get into this,
Sure.
we've got some great sources lined up.
Okay.
We've got the American Heart Association guidelines.
Uh-huh.
We've also got 2 landmark studies,
Right.
one from the New England Journal of Medicine
Mm-hmm.
and one from JMA,
Excellent.
to help us really unpack this whole thing.
Okay.
So first things first,
Okay.
let's talk about those AHA guidelines.
Sure.
What's the official stance when it comes to loading doses?
Well, the AHA guidelines actually recommend a 600 milligram loading dose of Clopidogrel,
Okay.
which is the generic name for Plavix.
Yeah.
This is particularly important for patients undergoing a thrombectomy, which is a procedure where they actually go in and remove the clot,
Oh, okay.
or for those who are at a high risk for another stroke.
So this is like a time is of the essence kind of thing.
Exactly.
And every second counts.
Every second counts.
Wow.
So the guidelines classify this as a Class I recommendation with Level B evidence.
Okay.
Think of it this way.
Yeah.
Like a restaurant that gets rave reviews from most food critics.
Okay.
But they haven't earned a Michelin star yet.
Interesting.
Still a pretty strong recommendation, though.
I like that.
Yeah.
That makes a lot of sense.
Yeah.
So it sounds like they're really advocating for this loading dose.
Yeah, they are.
And I'm guessing the logic there is you want to basically flood the system
Yes.
with this Plavix
Yeah.
to stop any further clotting.
You got it.
Right.
The goal is to get those antiplatelet levels up very quickly to prevent further damage.
Prevent further damage.
Yep.
Wow, this is
Yeah.
really interesting.
Yeah.
So we've got these guidelines
Right.
that seem to be pointing in the direction of loading doses.
They do.
But let's look at the research.
Okay.
Let's see what the studies actually say.
Yeah.
And we've got that NEJM study from 2010,
Yes.
a landmark study.
Big study. So tell me about that.
This study was a real game changer.
Okay.
They compared a 600 milligram loading dose to the standard 75 milligram dose.
Okay.
And the results were pretty remarkable.
All right.
The loading dose significantly reduced the risk of having another stroke,
Wow.
or what doctors call a mini stroke or a TIA or
Okay.
recurrent ischemic events.
So this study is basically showing that getting a large dose of Plavix quickly can actually prevent a second stroke.
Exactly.
That's huge.
Yeah.
It's crucial.
Very important.
Wow.
Yeah.
And we've also got the JMA study from 2013.
Yes.
So this one was a little bit different, right? They
Yeah.
focused on the timing.
Yes, they did. They looked at giving the loading dose within 24 hours of the stroke.
Correct.
So what did they find?
They found that not only did it lower the risk of those recurrent events, but it actually led to better outcomes for patients overall.
Wow.
Yeah.
When we talk about better outcomes,
Yeah.
what do we actually mean?
We're talking about things like improved neurological function,
Okay.
less disability after the stroke,
Mm-hmm.
and a higher chance of being able to return home and live independently.
So it's not just about preventing a second stroke.
No.
It's about improving quality of life.
Exactly.
Wow.
Yeah. Pretty big stuff.
Yeah, that's really incredible.
Yeah.
That a single dose can have such a big impact
Yeah.
on recovery.
Yeah. It's pretty powerful.
So I'm guessing,
Yeah.
even with all this evidence,
Right.
it's not like every single stroke patient automatically gets a loading dose.
You're absolutely right.
It's not a one-size fits
It's
all.
like a suit.
Okay.
You wouldn't buy a suit off the rack
Yeah.
and expect it to fit perfectly.
Right.
You need to tailor the treatment
Okay.
to each individual.
I love that analogy.
Yeah.
So what sorts of things would doctors be taking into consideration?
They'd look at things like the patient's age,
Okay.
other medical conditions,
Yeah.
other medications they might be taking,
Okay.
and their risk of bleeding complications.
Got it.
All these factors play a role.
Yeah. So many factors to think about.
Yeah.
This has been incredibly insightful.
Sure.
Really appreciate you walking us through all of this.
You're welcome.
So to kind of sum it all up
Yeah.
for our listeners,
Sure.
what's the bottom line here?
The bottom line is there's really strong evidence supporting Plavix loading doses in acute ischemic stroke.
Right.
But it's not a one-size-fits-all approach.
Gotcha.
The decision to use a loading dose needs to be made carefully in consultation with a healthcare professional who can really look at the individual patient's needs.
Absolutely. And it's incredible to see how these treatments can evolve,
Right.
especially in complex areas like stroke care.
It is.
I mean, who knows what the next few years might hold?
Exactly. It's an exciting time to be in medicine.
It really is.
Yeah.
And on that note,
Yes.
we encourage all of you to continue this conversation
Right.
with your healthcare provider.
Absolutely.
They are the best resource
Yes.
for personalized guidance.
Yes, they are.
Thanks for joining us
Thank you.
on this deep dive.
Have a good one.
We'll see you next time.
See you later. Bye.